An arrogant doctor with a fresh haircut and a tailored suit can demand my badge, but he has no idea he just fired the highest-ranking combat surgeon on the Eastern Seaboard. If you enjoy listening to stories like this, please subscribe to the channel and take a moment to let me know in the comments where you are tuning in from. My name is Maya Stone. For the past 14 months, the administrative staff at Mercy Crest Medical Center knew me simply as the quiet, soft-spoken floor nurse who always volunteered for the grueling graveyard shift. I showed up 15 minutes early for every rotation, kept my head down, and never spent time hanging around the central desk to gossip or complain about hospital politics. To the suits running the executive offices on the top floor, I was just a ghost in dark navy scrubs, an unremarkable, low-profile nurse who kept the emergency department running smoothly without ever making a scene. None of them knew about the heavy scars hidden beneath my uniform, or the 14 years I had spent serving active duty in the United States Navy. They didn't know that long before I ever stepped foot into Mercy Crest, I held the rank of commander in the medical corps, leading forward surgical teams in contested military zones. I had operated inside cramped tactical tents, while artillery shells rattled the surgical tables, stabilizing torn arteries under the dim glow of headlamps. When my last active deployment ended, I wanted nothing more than a quiet, predictable civilian routine. I wanted a job where emergencies arrived one at a time under bright fluorescent lights, with fully stocked supply rooms and clear procedures. I deliberately took a junior floor nursing position, hiding my real rank and medical credentials behind a simple employee badge, content to let everyone assume I was just a reserved nurse who preferred the dark, quiet hours of the night shift. Unfortunately, Mercy Crest Medical Center was no longer being run by medical professionals who understood the chaotic, unpredictable nature of human illness. It was run by corporate bureaucrats obsessed with digital metrics, door-to-discharge timers, and reimbursement tiers. And no one embodied that cold corporate mentality more than Dr. Preston Pierce, our newly appointed chief medical officer. He drove an Italian sports car, wore custom suits beneath a white lab coat, and walked through the wing as if inspecting a factory assembly line. He constantly reprimanded nurses for spending time at a patient's bedside, insisting every admission be processed and cleared within 45 minutes. It was exactly 05:45 a.m. on a cold, foggy Thursday morning, and my 12-hour shift was finally coming to an end. The heavy rain from earlier had settled into a thick, low-hanging mist outside. I was standing at the central nursing station, reviewing lab results and organizing chart files with Leo, a young resident nurse who had joined our graveyard shift 6 months earlier. Leo was dedicated and observant, making him one of the few staff members who understood my clinical approach. "Check these arterial blood gas levels for bed 7, Leo," I said softly, handing him a printed diagnostic slip. "Her oxygen saturation is hovering at 91%, and her systolic blood pressure dropped 10 points over the last hour." Leo looked at the numbers, frowning in concern. "That's Mrs. Gable, right? The 74-year-old admitted for mild respiratory distress? That's her." I nodded, keeping my voice low and steady. "The portal automatically flagged her for immediate discharge 30 minutes ago because her initial room air vitals met the basic software threshold. But if we send her home right now in this cold weather with those borderline blood gas levels, she'll be back in an ambulance with severe pneumonia before noon. Keep her on 2 liters of nasal cannula, order a stat chest x-ray, and hold her discharge papers until the attending physician conducts a full bedside review." Leo smiled with genuine admiration, taking the slip from my hand. "Got it, Maya. You always spot those subtle physiological drops long before the automated software even registers a warning." "Computers read numbers, Leo," I replied quietly, adjusting my stethoscope around my neck. "Nurses look at patients. Never let a software portal tell you a human being is stable when your clinical eyes tell you otherwise." Before Leo could respond, the sharp, authoritative click of expensive leather shoes echoed loudly down the central corridor, cutting through the rhythmic hum of the cardiac monitors. "Nurse Stone!" A loud, pompous voice boomed across the quiet station. I turned calmly to see Dr. Preston Pierce marching toward the desk. He was flanked by 2 senior surgical interns and 2 visiting members of the hospital's board of directors, showing them around the facility as if he were leading a high-end corporate tour. Pierce held a sleek digital tablet in his hand, his hair impeccably styled, his white lab coat spotless. "Good morning, Dr. Pierce," I said, keeping my posture relaxed and my voice professional. Pierce stopped at the central counter, resting one hand on his hip while flipping through his tablet screen. He scowled heavily, ensuring the visiting board members saw his commanding presence. Why is the administrative discharge summary for Bed 7 still marked as pending in the central portal? Pierce demanded loudly, raising his voice so every nurse and resident nearby could hear. Our mandatory door-to-discharge metric for low-acuity admissions is 45 minutes. Your shift is currently dragging down our entire quarterly efficiency score by 4 whole percentage points. Bed 7 is an elderly patient displaying signs of secondary respiratory compensation, I answered softly, maintaining eye contact. I placed a hold on her digital discharge papers until we receive her chest films and verify her arterial oxygenation. It was a clinical safety decision, doctor. Pierce scoffed loudly, turning toward the board members with an exaggerated roll of his eyes. A clinical safety decision? Pierce repeated, mocking my words with a condescending, arrogant smirk. You see, gentlemen, this is precisely the friction we encounter with legacy nursing staff. They lack the dynamic speed, the agility, and the metric-driven mindset required for a premier, modern facility like Mercy Crest. You spend far too much time hovering over basic admissions instead of keeping the line moving. Leo spoke up defensively from beside me. Doctor, Pierce. Maya was just making sure the patient didn't suffer an acute hypoxic event at home. I did not request your commentary, Nurse Leo, Pierce snapped, cutting the young nurse off with a harsh, dismissive gesture of his hand. Nurse Stone has displayed a concerning lack of urgency for months. She moves too quietly, speaks too softly, and frankly fails to project the high-energy, commanding presence that this institution demands from its floor staff. I didn't flinch. I didn't raise my voice or shift my weight. Having commanded trauma units during active military engagements, a vain administrator flexing his authority for corporate guests didn't intimidate me at all. I prioritize patient survival over software portal metrics, doctor, I stated calmly. Pierce's face flushed bright red at my steady, unbothered response. His fragile ego, clearly wounded by my refusal to bow before his visiting board members, completely snapped. He slapped his digital tablet hard onto the central counter, the loud bang echoing through the room like a gunshot. Bang! That is the final straw! Pierce spat, his voice trembling with manic, arrogant rage as he pointed a trembling finger directly at my face. Your persistent insubordination, your complete disregard for hospital protocols, and your open defiance of executive authority ends today. I will not allow a junior floor nurse to undermine the operational efficiency of my emergency department. He pulled a red administrative action form from his coat pocket and scribbled his signature across the bottom with aggressive, heavy strokes of his pen. You are suspended from Mercy Crest Medical Center effective immediately, Pierce announced loudly, slapping the paper onto the counter. Gross insubordination and deliberate obstruction of workflow. The central station fell into a suffocating silence. Leo stared at Pierce in absolute shock. Dr. Pierce, you can't be serious, Leo gasped, his voice shaking with outrage. Maya is the most experienced nurse on this entire floor. She saved 3 critical cardiac patients on this shift alone. Silence, Leo, Pierce barked, his eyes bulging with rage. If you utter one more word, I will sign a suspension form for you as well. Pierce turned his glare back to me, his sneer dripping with toxic condescension. Hand over your hospital ID badge right now, Nurse Stone, Pierce commanded, reaching out his open hand. You will pack your personal belongings from your locker and vacate these premises immediately. You are barred from entering any clinical area in this hospital until a formal executive review is conducted. I looked at the red paper on the counter, then looked up into Dr. Pierce's angry, flushed face. I didn't argue. I didn't plead for my job, and I didn't display a single trace of fear or anger. I unclipped my plastic hospital ID badge and laid it down quietly on top of the red suspension paper. You're making a massive mistake, Dr. Pierce, I said softly, my voice dropping into a low, icy register that made the 2 visiting board members step back unconsciously. The only mistake made here was allowing a quiet, slow-moving nurse like you to work in my department for this long, Pierce sneered, pulling the badge toward himself. Now pack your things and get out of my building before I have security escort you to the parking lot. I picked up my small black canvas duffel bag from behind the desk, slung it over my shoulder, and turned toward the exit doors, leaving Dr. Preston Pierce standing proudly at the central desk, completely unaware of the storm that was about to land directly above his head. I stepped out through the heavy glass exit doors of Mercy Crest Medical Center into the biting cold air of 6 o'clock in the morning. A thick, icy fog hung low over the damp asphalt, wrapping around the concrete pillars of the hospital building in a shroud of gray mist. I pulled the zipper of my black windbreaker all the way up to my chin, adjusting the strap of my canvas duffel bag over my shoulder. Behind me, the automatic doors slid shut with a soft pneumatic hiss, cutting off the artificial warmth, the chemical smell of floor wax, and the quiet hum of the central station where Dr. Preston Pierce was no doubt still preening in front of his visiting board members. I walked down the wet concrete ramp toward the employee parking lot, my boots making a slow, deliberate sound against the pavement. My fingers brushed against the empty fabric where my hospital ID badge used to hang. For 14 months, that little piece of plastic had been my camouflage, allowing me to blend into a quiet civilian ER, far from the heavy burdens of military command. Now, it lay on the counter beneath a red suspension order. Behind me, the glass doors opened, and Leo came sprinting out into the cold air, his face flushed. "Maya, wait!" Leo called out, running down the steps toward me. I stopped near the light post, turning around calmly. "You shouldn't be out here without a jacket, Leo. It's barely 40 degrees. You can't just walk away like this, Maya," Leo gasped, stopping a few feet away. "What Dr. Pierce did in there was completely insane. He suspended you over a software discharge timer just to flex in front of those board members. You're the best clinician on this floor." "It doesn't matter, Leo," I said softly, giving him a gentle, reassuring smile. "Dr. Pierce is the chief medical officer. Fighting with an administrator who cares more about digital portals than human physiology is a battle not worth fighting. Go back inside before you catch a cold." "It's not fair, Maya," Leo insisted, his voice cracking with genuine frustration. "He's going to ruin your employment record. He's going to write you up for gross insubordination. Fairness is a luxury we don't get in medicine, Leo," I replied quietly, patting his shoulder. "Only patient outcomes matter. Make sure the attending physician reviews Mrs. Gable's chest films before anyone touches her discharge papers." Leo bit his lip, nodding slowly, though his eyes were still burning with anger on my behalf. "I'll make sure she stays put. But this floor isn't going to be the same without you. You'll do fine, Leo. You have good clinical instincts. Trust them over the computer screens." I turned back toward the parking lot, taking a few steps down the walkway. But before Leo could step back inside the building, a strange, unnatural vibration rippled through the cold air. It started as a faint, low-frequency hum, a deep tremor that vibrated through the soles of my boots and buzzed against the concrete retaining wall of the parking garage. Within seconds, the subtle vibration intensified into a heavy, rhythmic thrumming that rattled the heavy glass panels of the hospital facade above us. Thump, 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 thump. "What is that?" Leo asked, frowning as he looked up into the dense, swirling fog overhead. "Is that a storm rolling back in?" "No," I said, stopping instantly in my tracks as my military training locked into place. "That's not thunder." The sound grew louder, deeper, and infinitely more aggressive. It was the thunderous, unmistakable chop of heavy, twin turboshaft engines cutting violently through the dense mist. A massive military aircraft flying extremely low and fast, approaching from the eastern coastline. Suddenly, the red and green navigational strobe lights of a heavy military helicopter burst through the thick fog, piercing the dim morning gloom like twin lasers. Whir, 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 thump, thump, thump. A massive MH-60S Seahawk transport helicopter emerged from the clouds, hovering above the hospital roof. The sheer force of its rotor wash hit the ground like a hurricane, whipping the rain-soaked trees and blasting a freezing wave of water droplets across the walkway. "Holy crap!" Leo yelled, shielding his eyes against the violent wind. "Why is a military chopper landing here? The city helipad traffic control hasn't sounded an incoming flight alarm." "Because they aren't asking for clearance," I said, my voice dropping into a sharp, focused register as I watched the aircraft maneuver. The MH-60S Seahawk did not execute a standard, slow civilian approach pattern. It dropped from the sky with aggressive military precision, its tail rotor banking hard to align with the rooftop landing pad of Mercy Crest Medical Center. The heavy landing gear struck the concrete pad with a loud, metallic thud that echoed off the surrounding buildings. Boom, clack. Before the twin turbine engines could even begin to spool down, the large sliding side door of the naval helicopter was thrown back with a violent metallic crash. Through the swirling fog and the blinding spray of water kicked up by the spinning rotor blades, 4 men in dark naval tactical uniforms leaped out onto the wet helipad floor. They weren't standard civilian flight paramedics. They were elite Navy special warfare operators and Fleet Marine Force corpsmen, wearing heavy tactical vests, waterproof maritime gear, and sidearms strapped to their thighs. "Move! Move! Move!" A harsh, commanding voice boomed out through an external headset radio, echoing over the deafening roar of the idling helicopter turbines. "Secure the perimeter! Get the primary gurney out now!" 2 tactical corpsmen hauled a heavy, ruggedized military field gurney out of the cabin, their boots skidding slightly against the slick, wet concrete of the helipad. Lying on the gurney was a man strapped down tight under heavy thermal blankets, surrounded by 3 active IV lines, a portable mechanical ventilator, and a heavy pressure dressing wrapped around his upper torso that was already completely saturated with fresh crimson blood. "We have an active arterial bleed in the left subclavian region," a corpsman screamed at the top of his lungs, his face covered in soot, salt spray, and dark blood as he leaned over the patient, applying frantic 2-handed pressure to the man's neck and chest. Heart rate is 140 and climbing. Systolic pressure is dropping past 60. He's going into profound hypovolemic shock. "Keep those pressure dressings tight, Jenkins," another voice barked over the turbine whine. Stepping out from the cockpit side of the aircraft was Captain Thomas Archer, a battle-hardened Navy officer and squadron commander, wearing a dark flight suit with tactical harness straps crossed over his chest. His face was pale, drawn with intense strain, and splattered with dark blood. On the gurney lay a man whose face was pale as ashes, his breathing shallow and desperate. Despite the oxygen mask and severe blast trauma covering his left shoulder, I recognized the gold stars pinned to the blood-stained collar of his uniform jacket beneath the blankets. It was Admiral Edward Ross, one of the highest-ranking commanders in the United States Fleet Forces, a legend in naval operations, and a man responsible for maritime security across the entire eastern seaboard. Admiral Ross was bleeding to death right on the roof of Mercy Crest Medical Center. "Where is the trauma team?" Captain Archer roared, stepping to the edge of the helipad railing and glaring down toward the emergency doors, his voice carrying raw, desperate fury over the roaring engines. "We signaled an emergency tactical divert 10 minutes ago. Get the chief surgeon out here right now." High above on the rooftop, the heavy access doors burst open. Dr. Preston Pierce, accompanied by 2 security guards and 2 surgical residents, rushed out onto the helipad, their lab coats flapping wildly in the rotor wash. "What is the meaning of this?" Dr. Pierce shrieked, his voice thin and hysterical as he held his hands over his head to protect his hair from the hurricane-force wind. "You cannot land a military warship on my hospital roof without prior executive authorization. You are violating airspace regulations and hospital safety protocols." Captain Archer turned on Pierce, stepping directly into his path with pure contempt. "Shut your mouth, civilian!" Archer roared, grabbing Pierce by his white coat and hauling him off the ground. On that gurney is Admiral Edward Ross. He was struck by primary shrapnel during a classified offshore interdiction exercise 40 miles off the coast. His subclavian artery is severed, and he has a secondary tension pneumothorax. We don't give a damn about your authorization. Open those doors and prepare your primary surgical suite right now." Dr. Pierce stared at the officer, then looked over at the gurney where corpsmen were frantically holding blood-soaked dressings over a gaping wound. The moment Dr. Pierce saw the arterial blood pooling on the helipad floor, his face drained of color, turning ghost white. His knees trembled, and his hands began to shake violently. I can't accept a critical military trauma of this magnitude without administrative intake forms," Pierce stammered, his voice cracking into a high-pitched whimper as he backed away from Archer, clutching his tablet to his chest like a shield. "Where are the field medical records? Where is the military transfer protocol? We don't have an open operating room assigned in the digital portal system. He's bleeding out on your floor, you pathetic coward, Captain Archer screamed, shoving Pierce backwards so hard the administrator stumbled over a water pipe, dropping his tablet onto the wet concrete. Get your doctors over here and stop his bleeding. Inside the rooftop vestibule, the civilian surgical resident stood completely frozen, paralyzed by the deafening noise, the blinding fog, and the sight of a 4-star admiral dying in front of them without a single computer monitor to guide them. Standing on the walkway below, I watched through the glass railing. My duffel bag was slung over my shoulder, and my badge was gone. But the combat surgeon inside me, the Navy commander who had saved dozens of lives under fire, awoke with a surge of razor-sharp adrenaline. The deafening roar of the MH-60S Seahawk's twin turbine engines vibrated violently through the reinforced concrete structure of Mercy Crest Medical Center, sending cold, rain-soaked wind whipping frantically across the rooftop helipad. High above the city mist, the scene on the wet landing pad was descending into complete, horrifying chaos. On the heavy tactical field gurney, Admiral Edward Ross lay motionless beneath thermal blankets, his face a ghostly, ashen shade of gray beneath a transparent plastic oxygen mask. The thick pressure dressing wrapped around his left shoulder and subclavian region was completely saturated with dark, purple-red arterial blood, which was spilling over the edges of the heavy canvas and pooling on the wet concrete floor in steady, terrifying rivulets. Beside him, 2 tactical Navy corpsmen were fighting a desperate, losing battle for his life. Petty Officer Jenkins was leaning his entire body weight into the Admiral's left collarbone area, his gloved hands pressed firmly over the severed vessel, but bright red arterial blood was still seeping through his fingers with every erratic, weakened beat of the officer's failing heart. Beep, 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 beep. The ruggedized portable field monitor mounted to the side rail of the gurney began to scream with violent, continuous alarm tones that pierced through the deafening turbine noise. The digital numbers on the battery-powered screen were flashing in bright, angry red. Systolic blood pressure had dropped past 58, oxygen saturation was plummeting through 82%, and the heart rate was climbing past 145 beats per minute in a desperate dying surge. "He's crashing!" Jenkins screamed at the top of his lungs, his voice raw with terror over the deafening whine of the idling rotor blades. "Systolic is under 60. Map is completely gone. We're losing his central carotid pulse. We need an immediate surgical vascular clamp, an emergency chest tube, and central line access right now." Standing 5 feet away on the slick, rain-soaked concrete, Dr. Preston Pierce was completely, utterly undone. The chief medical officer of Mercy Crest Medical Center was trembling uncontrollably from head to toe, his pristine white lab coat ruined by crimson blood splatters and rain. His expensive, custom-made leather shoes were standing directly in a growing puddle of dark arterial blood, but he seemed physically incapable of taking a single step forward. The arrogant, condescending authority he had projected downstairs at the central desk just 15 minutes earlier had vanished entirely, replaced by pure, unadulterated panic. Behind him, 2 hospital security guards stood frozen like stone statues, clutching their belts in sheer confusion, while 2 junior surgical residents backed away toward the rooftop access doors, their eyes wide with absolute, unmitigated horror. Get those portable monitors away from me!" Dr. Pierce shrieked, his voice rising into a hysterical, high-pitched squeak as he held his hands up defensively in the air. "Why aren't those telemetry readouts syncing with our main server grid? Where's the administrative intake clearance? I cannot initiate a clinical evaluation without a synchronized patient profile in the central digital portal system." Captain Thomas Archer, his dark flight suit covered in salt spray and blood, stepped up to Pierce with lethal, predatory intensity. "Are you out of your mind, civilian?" Archer roared, grabbing Pierce by his wet lapels again and shaking him violently until the doctor's teeth rattled. "His subclavian artery is severed. He doesn't have a central portal profile. He was pulled out of an offshore explosive blast radius 20 minutes ago. If you don't open those trauma doors and start emergency vascular access right now, he will flatline on this wet pad in 3 minutes." I am the chief medical officer," Pierce stammered, his teeth chattering uncontrollably as cold sweat mixed with rain on his pale face. "Hospital policy strictly prohibits accepting unverified trauma admissions without signed administrative transfer documentation. Security. Security. Enforce perimeter boundary protocols. Do not allow this unverified gurney to enter the internal elevator corridor. The two civilian security guards exchanged terrified, hesitant glances, but neither of them dared to take a step toward the battle-tested special warfare operators surrounding the gurney. "You pathetic piece of trash!" Captain Archer spat. Shoving Pierce backward so hard the administrator slammed his back hard against the metal safety railing of the helipad. Dr. Pierce stumbled, clutching his shoulder, his wild eyes darting frantically around the rain-slicked roof. He looked at the screaming portable monitor, looked at the pool of arterial blood spreading toward his shoes, and completely lost whatever rational thought he had left. Without access to his pristine operating rooms, his fully stocked electronic supply carts, and his automated digital software prompts telling him step-by-step what buttons to press, Dr. Pierce was entirely useless. He was a doctor who had spent years hiding behind administrative metrics, corporate spreadsheets, and surgical prestige, completely disconnected from the raw, bloody reality of emergency trauma medicine under extreme pressure. Desperate to project some semblance of control in front of his frozen residents, Pierce reached out with trembling hands, grabbing a standard stethoscope from his coat pocket. He stumbled forward toward the gurney, his face contorted in a manic, panicked scowl. "Stand aside!" Pierce screamed at Jenkins, his voice cracking hysterically over the turbine roar. "I am a board-certified surgeon. I will conduct a baseline auditory assessment of his pulmonary fields before any physical movement is authorized." "Auditory assessment?" Jenkins yelled back in total stunned disbelief. "He has an active arterial bleed and a tension pneumothorax. You don't need a stethoscope. You need a chest needle and a vascular clamp." Pierce ignored the corpsman, shoving his trembling hands forward. In his complete panicked disorientation, Pierce didn't even notice that the rubber tubing of his stethoscope was twisted and wrapped backward around his own arm. He tried to place the cold diaphragm against the Admiral's blood-soaked chest, but his hands were shaking so violently that he dropped the stethoscope onto the bloody gurney sheet. I can't hear clear breath sounds," Pierce shrieked, backing away in a frenzy, his eyes bulging wildly in the dim light. "He's thrashing! He's in acute cerebral agitation! He needs immediate chemical suppression! Get me a syringe of midazolam and a paralytic agent from the emergency flight kit. We need to paralyze his diaphragm and force a mechanical airway." "Doctor, no!" Leo's voice suddenly echoed from the rooftop doorway. Leo had sprinted up the concrete stairs behind Pierce and was now standing at the edge of the helipad, staring in absolute terror at what the chief medical officer was trying to do. "If you give him a paralytic right now while his blood pressure is 60/30, his sympathetic vascular tone will collapse completely," Leo screamed over the roaring wind, stepping forward frantically. "His heart will stop in 15 seconds. You'll kill him." "Shut up, Nurse Leo," Pierce shouted back, his voice completely unhinged as he grabbed a small emergency medication pouch from a security guard's belt. "I am the surgical director of this hospital. I dictate clinical protocol. He requires immediate chemical paralysis to secure the airway according to standard algorithm guidelines." On the gurney, Admiral Edward Ross's chest gave a violent, spasmodic heave. His lips turned a deep, dark cyanotic blue under his oxygen mask, and his left jugular vein bulged thick and dark against his pale neck, a textbook sign that the trapped air in his chest cavity was now crushing his vena cava and cutting off all blood return to his heart. Beep, 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 beep. The portable field monitor let out a continuous, ear-splitting, flatline warning tone as the Admiral's systolic blood pressure plummeted down to 42. "His heart is failing!" Petty Officer Jenkins roared, leaning his forearm into the blood-drenched shoulder wound while trying to manually pump air into the Admiral's lungs with a bag valve mask. "The tension pneumothorax is choking his heart. We're losing him right now. Is there anyone in this damn hospital who knows how to save a life in the dark?" "Doctor." Preston Pierce stood frozen beside the metal railing, holding a trembling syringe in his gloved hand, his eyes wide, hollow, and utterly blank. He looked at the flatlining screen, looked at the arterial blood soaking his leather shoes, and completely paralyzed into absolute silence. The two civilian surgical residents shrank back against the concrete wall, covering their faces in horror, while the corpsmen screamed for help into the freezing, rain-soaked wind. The chief medical officer and his entire team were completely paralyzed, trapped in pitch-black clinical incompetence while a 4-star admiral bled to death on their roof. Standing in the shadow of the rooftop access doorway, I watched the entire catastrophe unfold through the freezing drizzle. I had dropped my black canvas duffel bag onto the wet concrete floor behind me. My eyes locked on the flatlining monitor, the trembling syringe in Dr. Pierce's shaking fingers, and the dark arterial blood pooling around his leather shoes. I saw a chief medical officer whose entire career was built on corporate spreadsheets, portal timers, and artificial prestige, completely unraveling the moment he was stripped of his digital screens and forced to face real combat trauma. The civilian surgical team was paralyzed by fear. Dr. Pierce was seconds away from administering a lethal dose of paralytics to a dying officer, and Admiral Edward Ross was slipping into irreversible cardiac arrest on the cold, wet pad. The soft-spoken floor nurse named Maya Stone, who had spent 14 months quietly hiding behind a plastic employee badge, was gone. In her place stood Commander Maya Stone, the Navy combat surgeon who had run forward surgical teams under heavy artillery fire in contested military zones. I took a deep, steady breath, my pulse dropping into a calm, ice-cold rhythm as my military training took complete control of my mind and body. I stepped out from the shadow of the rooftop doorway, my heavy black boots striking the wet concrete helipad with a firm, deliberate thud that sounded like a gunshot over the howling wind. I didn't run. I didn't hesitate. Every single movement was controlled, precise, and dictated by years of muscle memory forged in high-intensity combat zones across the globe. The cold, rain-soaked wind whipped across my face, driving ice-cold water droplets into my eyes. But I barely felt it. My gaze was locked onto Dr. Preston Pierce's shaking gloved hand, holding the pre-filled syringe over Admiral Ross's blood-soaked chest. "Drop that syringe right now, Dr. Pierce," I commanded. My voice wasn't loud or panicked. It was low, sharp, and carried a chilling, lethal authority that cut clean through the deafening roar of the MH-60S Seahawk's idling turbine engines and the torrential downpour. Dr. Pierce flinched violently, almost dropping the glass syringe onto the wet pad. He spun around, his face contorted in a mixture of sudden surprise, humiliation, and wild, manic rage as he saw me standing 5 feet away in my dark navy scrubs. "You!" Pierce shrieked, his voice cracking into a pathetic, high-pitched squeak that sounded ridiculous against the storm. "What in God's name are you doing on my helipad, Nurse Stone? You are under active administrative suspension. You were ordered to pack your things and vacate hospital grounds immediately." "I said drop the syringe," I repeated, taking 3 deliberate steps forward until I stood directly between Pierce and the gurney. My eyes locked onto his with an icy, unyielding glare that made the chief medical officer step back half a pace. "If you push 50 milligrams of a paralytic agent into an adult male with a systolic blood pressure of 42, his peripheral vascular resistance will drop to 0 in 5 seconds. You will induce complete, irreversible cardiac arrest before you even uncap your laryngoscope." "Do not lecture me on pharmacology, you low-level floor nurse," Pierce screamed, his face turning a dark toxic purple as he tried desperately to project authority in front of his frozen residents. "I am a board-certified surgeon and the surgical director of this entire medical center. You are an insubordinate, unemployed civilian who has no legal or clinical right to be anywhere near this pad. Security, arrest this woman right now." The 2 civilian security guards took one hesitant step forward, but before they could even reach for their utility belts, Captain Thomas Archer moved. Archer had been reaching for his sidearm in sheer frustration over Pierce's incompetence. But when my voice rang out across the helipad, he froze dead in his tracks. He turned his head slowly, his bloodshot, exhausted eyes narrowing through the heavy rain and fog as he looked directly at my face. He stared at my posture, my dark navy scrubs, and the cold, unshakable calm in my eyes. Then his gaze dropped to the small, faint surgical scar running along the side of my jawline, a combat wound sustained during a high-stakes maritime casualty evacuation 7 years ago in the Arabian Sea. Captain Archer's eyes bulged in absolute, awestruck shock. The color drained completely from his weathered face, not from fear, but from profound, sudden military recognition. Mother of God, Archer breathed out, his voice trembling as he took a slow, disbelieving step toward me. Commander Stone? Petty Officer Jenkins, who was still leaning his full body weight into the Admiral's bleeding subclavian artery, snapped his head up instantly. His eyes widened in utter disbelief as he stared at my face through the pouring rain. Doc Stone? Jenkins gasped, his jaw dropping beneath his soot-stained face. Commander Maya Stone? Chief Surgical Officer of Forward Surgical Team 3? A sudden electric shock wave passed through the 4 Navy Special Warfare operators and tactical flight corpsmen surrounding the gurney. The atmosphere on the wet helipad shifted instantly from frantic desperation to absolute razor-sharp military discipline. Without a single second of hesitation, Captain Thomas Archer brought his heavy boots together with a sharp metallic click that echoed off the wet concrete walls. He stood at rigid, flawless military attention, raised his gloved right hand to his brow, and delivered the crispest, most formal salute I had seen in years. Beside him, Petty Officer Jenkins and the 3 tactical operators immediately snapped into rigid attention alongside their captain, their hands raised high in unison, despite the roaring wind, the spinning rotor blades, and the torrential drizzle. "Commander on deck!" Captain Archer bellowed at the top of his lungs, his voice carrying the thunderous, unyielding authority of a senior naval commander. "Commander on deck!" The 3 tactical operators roared back in unison, their raspy, disciplined voices echoing across the entire rooftop helipad. The entire helipad fell into a stunned, breathless silence, broken only by the rhythmic chop of the helicopter blades overhead and the howling wind. Dr. Preston Pierce stood frozen in place, his mouth hanging half open, his eyes darting frantically between me and the 4 battle-hardened Navy officers standing at rigid military attention before me. The syringe trembled violently in his gloved fingers, dropping 3 droplets of liquid onto his wet sleeve. What are you talking about?" Pierce stammered, his voice shaking with confused, pathetic rage as he pointed a finger at me. "She isn't a commander. She's a floor nurse, a junior floor nurse who works the graveyard shift. She doesn't even have a valid hospital ID badge. She was suspended 20 minutes ago for gross insubordination and failing portal metrics." Captain Archer didn't even turn his head to look at Pierce. He kept his eyes locked on mine, his hand held high in an unwavering, respectful salute. "Commander Maya Stone," Archer announced loudly, his commanding voice carrying across the wet roof so every security guard, floor nurse, and resident could hear every word clearly. "United States Navy Medical Corps. Former Chief of Trauma and Vascular Surgery for Forward Surgical Team 3 in Afghanistan and the 5th Fleet Strike Group. Recipient of the Distinguished Service Cross and 2 Purple Hearts." Behind Pierce, Leo gasped out loud, his hands flying to his mouth in absolute, jaw-dropping astonishment. He looked at me as if everything about my quiet, hyper-precise nursing style over the past 14 months suddenly made perfect, overwhelming sense. The 2 junior surgical residents shrank back against the wet concrete wall, looking at me as if a mythical titan had just materialized in front of them out of the ocean fog. "Is it really her?" one of the residents whispered in a trembling, awestruck voice. "The Navy surgeon who performed a successful open-chest aortic cross-clamp inside a sinking transport craft during the Gulf interdiction?" "She's a military legend," the second resident breathed out, his face turning pale with pure reverence. Pierce's face contorted into a grotesque mask of utter disbelief and humiliating toxic fury. He looked at me, his eyes wide, bloodshot, and bulging, his chest heaving under his blood-stained lab coat. "This is insane!" Pierce shrieked, waving his hands frantically like a child throwing a tantrum. "I don't care what she used to be in the military. This is a private civilian medical facility. She has no active clinical privileges here. I am the chief medical officer, and I strictly forbid her from touching this patient." Captain Archer dropped his salute, turned slowly toward Dr. Pierce, and stepped into his personal space like an immovable iron wall. "Listen to me very carefully, you pathetic little bureaucrat," Archer growled, his voice dropping into a low, terrifying rumble that chilled the air between them. "The man lying on that gurney is Admiral Edward Ross, Commander of United States Fleet Forces. Under Title 10 of the United States Code and Emergency Military Medical Directives during classified maritime operations, military medical authority overrides civilian administrative protocol." Archer reached out, grabbed the syringe from Pierce's trembling fingers, and threw it off the side of the helipad, where it plummeted into the dark fog 70 feet below. You dropped your stethoscope, you panicked when the monitors alarmed, and you almost executed a 4-star admiral because you don't know how to assess a patient without a computer screen. Archer spat, his eyes burning with pure military contempt. You are relieved of all clinical authority over this casualty. Archer turned back to me, taking a formal step forward and extending his hand in a gesture of absolute trust and military alignment. Commander Stone, Captain Archer said formally, his voice ringing with absolute clarity over the storm. Admiral Ross is in profound hypovolemic shock from a severed subclavian artery and a crushing tension pneumothorax. Our flight medics have done everything they can, but he is flatlining. The deck is yours, ma'am. I looked at Captain Archer, then looked down at Admiral Edward Ross lying on the blood-soaked gurney. His breathing was fading into shallow, agonizing gasps, his blood pressure screen flashing red in its final warning cycle. The time for hiding behind civilian scrubs was over. Jenkins, hold direct pressure on the proximal vessel, I commanded, my voice flat, calm, and ringing with absolute, unshakable authority that instantly filled the entire space. Leo, get the emergency surgical tray from the flight kit and prep a 14-gauge decompression needle immediately. Yes, Commander, Leo yelled back, without a single second of hesitation, sprinting toward the helicopter flight kit. Dr. Pierce stood paralyzed beside the railing, his face burning with a mixture of profound humiliation, utter powerlessness, and blinding rage as he watched me take absolute, unyielding command of the helipad. The heavy double doors of the emergency department flew open with a violent, echoing crash, slamming hard against the magnetic wall locks as our tactical procession stormed into the main clinical corridor. The bright, blinding fluorescent lights of the civilian hospital washed over our rain-soaked uniforms, a jarring, sterile contrast to the dark, freezing hurricane we had just left behind on the rooftop helipad. Clear the corridor. Make way. Captain Thomas Archer roared, his deep, authoritative voice booming through the quiet hospital wing like a shockwave. Military medical emergency. Clear this entire pathway right now. The civilian night shift staff, nurses, medical technicians, and junior doctors who had been quietly charting at their stations, froze in absolute shock. They stared in wide-eyed disbelief as 4 massive, battle-hardened Navy Special Warfare operators marched down the center of their pristine hallway, pushing a heavy tactical field gurney covered in dark, fresh blood, and walking at the absolute center of that military formation, barking rapid-fire medical orders, was me, their quiet, unassuming graveyard shift floor nurse, Maya Stone, now completely commanding a Navy SEAL team. Leo, bypass standard intake, I commanded, never breaking my stride as my boots squeaked loudly against the polished linoleum. I need Trauma Bay 1 unlocked and fully prepped. I want the Belmont Rapid Infuser primed with normal saline, and I need the blood bank to release 4 units of O-negative uncross-matched whole blood immediately. Tell them Commander Stone is overriding the requisition protocol under Emergency Trauma Authority. On it, Commander, Leo shouted back, sprinting ahead of the gurney like a man possessed. He reached the sliding glass doors of Trauma Bay 1, swiping his access card and throwing the heavy doors wide open. The room was massive, sterile, and equipped with the highest tier of civilian surgical technology, the exact controlled environment we desperately needed to save Admiral Ross's life. Lift on 3, I ordered as the operators wheeled the tactical gurney directly alongside the primary trauma table. 1, 2, 3, shift. The 4 Navy operators moved in perfect, synchronized harmony. With a singular, powerful heave, they lifted Admiral Ross's heavy frame from the portable field gurney and transferred him flawlessly onto the pristine white sheets of the hospital's primary surgical bed. Instantly, the stark white linens began to stain with the dark red arterial blood still seeping from the heavy junctional packing I had placed in his left subclavian crease. Jenkins, do not release that manual pressure, I instructed sharply, moving directly to the head of the bed to evaluate the Admiral's airway. Keep your body weight locked onto that packing. If that kaolin clot breaks loose before I can place a permanent surgical clamp on the artery, he bleeds out in 60 seconds. I'm not moving a muscle, Commander, Petty Officer Jenkins grunted, his arms trembling slightly from the sheer physical exertion of holding the Admiral's life in his hands for the past 30 minutes. "Leo, get him on the civilian telemetry monitors right now," I ordered, pulling on a fresh pair of sterile surgical gloves from the wall dispenser. "I want a 12-lead EKG, continuous pulse oximetry, and an invasive arterial line pressure reading." Leo moved with lightning speed, attaching the sticky telemetry pads to the Admiral's pale, cold chest and wrapping the blood pressure cuff around his uninjured right arm. Within seconds, the large, high-definition digital monitors mounted on the wall above the bed booted up, displaying the Admiral's vital signs in bright, glowing colors. For a brief, fleeting moment, the numbers looked stable. The tension pneumothorax decompression I had performed on the roof was holding. The oxygen saturation was hovering at 93%, and his systolic blood pressure was holding at a fragile 72. But as I looked closer at the green EKG rhythm dancing across the top of the monitor, a cold, dark sense of dread washed over me. The electrical waveform of his heart was shrinking. The peaks of the QRS complexes were becoming smaller and smaller with every passing second, alternating in height in a classic, terrifying pattern. "Electrical alternance," I whispered, my eyes narrowing as my clinical instincts flared. Suddenly, the monitor began to chime with a frantic, escalating warning tone. Beep, 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 beep. The Admiral's systolic blood pressure plummeted from 72 down to 50, then 45, then 38. The waveform on the pulse oximeter flattened out into a barely visible ripple. "Commander, his pressure is dropping rapidly," Leo shouted in panic, looking back and forth between the crashing monitor and the Admiral's pale face. "Systolic is down to 35. The quick clot packing is holding. There's no new external bleeding, but he's crashing. Why is he crashing?" I looked at the Admiral's neck. The jugular vein, which had flattened out after I decompressed his lung, was now bulging massively against his skin once again. I placed my stethoscope against his chest, right over his heart, and listened intently. The rhythmic, powerful beating of a human heart was completely gone. Instead, I heard a faint, distant, muffled sloshing sound, as if his heart was trying to beat underwater. "He has a secondary internal hemorrhage," I diagnosed instantly, my voice cutting through the panic with icy, absolute certainty. The blast shrapnel didn't just sever his subclavian artery. A microscopic fragment penetrated his pericardial sac. His heart is bleeding into its own protective lining. The blood is filling the sac, crushing his heart from the outside in. It's a massive cardiac tamponade. "His heart is being squeezed to death?" Captain Archer asked, stepping closer to the bed, his face grim and pale. "Yes," I replied, grabbing a betadine swab and tearing it open. The pericardial sac is a rigid membrane. It doesn't stretch. As it fills with blood, the heart loses the physical space to expand and pump. If I don't drain that blood right now, his heart will stop completely. Before I could reach for the surgical tray, the sliding glass doors of Trauma Bay 1 were violently shoved open. Dr. Preston Pierce burst into the room, his face red with manic, desperate rage. He was flanked by 3 heavily armed hospital security guards and the 2 junior surgical residents, who looked terrified to even be in the same room as the Navy Special Warfare operators. Pierce's lab coat was still stained with the blood from the helipad, but inside the bright, familiar walls of his own emergency department, his arrogant, toxic ego had momentarily returned. "Step away from that patient immediately," Dr. Pierce screamed, his voice cracking as he pointed a trembling finger directly at my face. "This is an unauthorized, illegal use of a trauma bay. Security, I am ordering you to physically remove Nurse Stone and these military personnel from my department. They are practicing medicine without a license." The hospital security guards hesitated, their hands hovering near their belts, eyeing Captain Archer and his heavily armed Navy operators with extreme caution. Pierce looked up at the wall monitor. He saw the shrinking EKG waveform and the plummeting blood pressure numbers flashing in bright red. Because he was a bureaucrat who had spent years looking at software algorithms instead of real patients, he immediately misread the clinical presentation. "He's in pulseless electrical activity," Pierce yelled triumphantly, acting as if he had just solved a puzzle. "His heart is failing from hypovolemic shock. He needs immediate chemical resuscitation and chest compressions. Nurse Leo, hand me 1 milligram of intravenous epinephrine and prepare to initiate CPR." "Do not touch his chest," I roared, my voice carrying a sudden, terrifying ferocity that froze everyone in the room. Pierce ignored me. Desperate to prove his authority in front of his residents, he lunged toward the trauma cart, grabbing a pre-filled plastic syringe of epinephrine. He ripped the cap off with his teeth and rushed toward the Admiral's IV line, while simultaneously raising his other hand, preparing to slam his palms down onto the Admiral's sternum to start chest compressions. "If you compress his chest, you will kill him," I shouted, stepping aggressively into Pierce's path. "Get out of my way, you insubordinate floor nurse," Pierce spat, trying to shove past me. "He is in cardiac arrest. The algorithm demands chest compressions and epinephrine." As Pierce raised his hands to press down on the Admiral's chest, I moved with the speed and precision of a trained combat veteran. I didn't yell again. I didn't argue. I simply reached out, grabbed Dr. Pierce by the wrist of his right hand, and twisted his arm downward in a devastatingly painful joint lock. "Ah!" Pierce shrieked, dropping the epinephrine syringe onto the sterile floor as he was forced to his knees by the sheer mechanical leverage of my grip. I leaned down, my face inches from his, my dark eyes burning with absolute, uncompromising lethal intent. "He is not in standard cardiac arrest, you incompetent fool," I whispered, my voice a razor-sharp hiss that echoed clearly through the silent trauma bay. "He is suffering from a cardiac tamponade. His heart is surrounded by a pressurized sac of blood. If you push epinephrine, his heart will try to beat faster against an immovable wall. If you perform chest compressions, you will physically rupture his myocardium and blow his heart into pieces. You are relying on a generic software algorithm because you lack the clinical skill to actually look at the patient in front of you." I shoved Pierce backward. He tumbled across the slick linoleum floor, crashing into the rolling supply cart and sending plastic bandages scattering everywhere. "Captain Archer," I said calmly, not even looking at Pierce as I turned back to the surgical tray. "Commander?" Archer responded instantly. "Remove this civilian administrator from my trauma bay," I ordered. "If he attempts to re-enter this room, you have my full military authorization to restrain him to a radiator until the federal police arrive." "With absolute pleasure, ma'am," Captain Archer growled. Archer stepped forward, grabbed Dr. Pierce by the collar of his ruined white lab coat, and physically dragged the whimpering, disgraced chief medical officer across the floor. He threw Pierce out into the main hallway like a bag of garbage, turning around and locking the heavy glass doors of the trauma bay from the inside. The 2 junior surgical residents stood trembling in the corner of the room, looking at me with absolute awe and terrified reverence. "You two," I said, pointing a blood-stained glove at the civilian residents. "Stop standing there like statues. Get over here, put on sterile gloves, and assist Leo with the rapid infuser. We are going to save this man's life right now." The residents scrambled to obey, tearing open sterile glove packets and rushing to the bedside with renewed, frantic energy. "Monitor is bottoming out, Commander," Leo warned, his eyes glued to the screen. "Systolic is 28. We are out of time." "Spinal needle, Leo. Now," I commanded. Leo slapped a long, 6-inch, heavy-gauge spinal needle into my waiting hand, attaching a large, empty 50-milliliter plastic syringe to the back of it. I looked down at Admiral Ross's pale, lifeless chest. The lights above were blindingly bright, casting no shadows. This was the exact procedure I had performed in the back of a shaking transport truck in Sangan Valley. But now, I had the luxury of light and stillness. I placed my left index finger directly over the Admiral's xiphoid process, the small bony cartilage at the very bottom center of his rib cage. "Starting subxiphoid pericardiocentesis," I announced, my voice entirely devoid of panic or fear. I angled the long steel needle at a precise 45-degree angle, pointing the sharp tip directly toward the Admiral's left shoulder. With a smooth, steady, and unhesitating motion, I drove the 6-inch needle deep into his chest, sliding it carefully beneath his rib cage, navigating blindly through the dense muscle and tissue toward the sac surrounding his failing heart. The room held its collective breath. The only sound was the frantic, dying beep of the monitor. I pulled back slowly on the plunger of the syringe. Instantly, dark, non-clotting blood flashed into the clear plastic barrel of the syringe. "I'm in the pericardial sac," I confirmed. I pulled the plunger all the way back, drawing 50 milliliters of trapped, pressurized blood directly out of the sac surrounding the Admiral's heart. I detached the full syringe, handed it to a wide-eyed resident, attached a fresh syringe, and drew out another 50 milliliters. As the second syringe filled with dark blood, the physical pressure crushing Admiral Ross's heart vanished. Beep, 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 beep. The monitor above us exploded with life. The shrinking electrical waveform instantly doubled in size, snapping back into a strong, powerful, and rhythmic sinus rhythm. The systolic blood pressure numbers rocketed upward in real time, climbing from 28 to 50 to 80, and finally stabilizing at a strong, beautiful 110. "Pressure is normalizing," Leo shouted, tears of pure relief welling up in his eyes. "Heart rate is 90. Oxygen is 98%. You did it! You actually did it!" Petty Officer Jenkins let out a loud, triumphant roar of victory, his face covered in sweat and soot. "That's my commander. That's Doc Stone." I didn't celebrate. I didn't smile. I just dropped the bloody syringe onto the sterile tray and moved directly toward the Admiral's left shoulder. "We bought his heart back," I said, my voice steady and relentless. "Now we secure the leak. Give me a vascular clamp, heavy silk sutures, and prep the rapid infuser to push 2 units of O-negative blood simultaneously." For the next 45 minutes, Trauma Bay 1 operated under flawless, absolute military precision. Under the bright surgical lights, I carefully removed the quick-clot kaolin packing from the Admiral's subclavian crease. With the residents holding the retractors and Leo managing the suction, I isolated the torn, bleeding subclavian artery. My hands moved with the speed and delicate precision of a master watchmaker. I applied a titanium vascular cross-clamp directly over the tear, halting the arterial bleeding completely and permanently. I threw a series of complex, reinforced silk sutures into the damaged vessel wall, rebuilding the artery stitch by stitch until the structural integrity of the vein was completely restored. By the time I cut the final suture thread and stepped back from the table, Admiral Edward Ross was no longer a dying casualty of war. His skin was warm and pink. His chest was rising and falling in deep, even rhythmic breaths. His blood pressure was perfectly stable. I pulled off my blood-soaked surgical gloves, dropping them into the red biohazard bin with a soft thud. I looked up at the wall monitor, watching the strong, steady green line of his heartbeat dancing across the screen. Captain Archer walked up to the side of the bed, placing a gentle, respectful hand on the Admiral's uninjured shoulder. He looked at the monitor, then turned to look at me. The battle-hardened Navy officer had tears shining in the corners of his eyes. "He's going to make it, isn't he?" Archer asked softly. "He is fully stabilized, Captain," I replied, feeling a deep, profound sense of peace settle over my tired shoulders. "He will need secondary vascular reconstruction in a formal operating room, but the immediate threat to his life is over. He's going to live." A spontaneous, overwhelming wave of applause erupted inside the trauma bay. The tactical operators, Petty Officer Jenkins, Leo, and the 2 civilian residents began cheering, clapping, and celebrating in an outpouring of sheer, unadulterated relief and victory. I turned around and looked toward the sliding glass doors of the trauma bay. Standing on the other side of the glass, locked out of his own emergency department, was Dr. Preston Pierce. His expensive clothes were ruined, his authority was completely shattered, and his face was pressed against the glass in utter, devastating defeat. He watched helplessly as the quiet, unassuming floor nurse he had arrogantly fired just an hour ago saved the life of a national hero, proving once and for all that real medicine is forged in blood, courage, and truth, not in digital portals and corporate spreadsheets. The bright fluorescent lights of Trauma Bay 1 hummed with a quiet, sterile electric buzz, providing a stark and comforting contrast to the violent, freezing hurricane still raging outside the thick glass windows of the emergency department. Inside the room, the chaotic, frantic energy of the past hour had completely evaporated. The screaming alarms, the desperate shouts, and the raw, suffocating panic had all been replaced by the rhythmic, steady, and beautiful sound of the mechanical ventilator pumping precise volumes of oxygen into Admiral Edward Ross's lungs. I stood at the stainless steel surgical sink in the corner of the trauma bay, pressing my heavy combat boot against the floor pedal to activate the warm water. I grabbed a sterile sponge and began to scrub the dry, dark arterial blood from my forearms and hands, watching the crimson water swirl slowly down the metal drain. It was an incredibly familiar sight, I had stood at dozens of surgical sinks exactly like this one, in the dusty, sweltering medical tents of Kandahar, in the reinforced concrete bunkers of Fallujah, and in the vibrating, cramped surgical bays of amphibious assault ships sailing through the Persian Gulf. But this was the very first time I was washing the blood of a 4-star flag officer off my hands inside a civilian hospital in my own city. "Commander," Captain Thomas Archer said softly, his deep voice breaking the quiet hum of the room. I turned off the water, grabbed a sterile blue surgical towel, and dried my hands as I turned to face him. The battle-hardened Navy squadron commander was leaning against the heavy stainless steel trauma cart, looking physically exhausted, but profoundly relieved. His dark flight suit was completely ruined, soaked in salt water, rain, and blood, but his posture remained rigid and respectful. "The fleet commander's office has just been notified via encrypted satellite relay," Archer reported, his eyes glancing over at the sleeping admiral. "They are dispatching a secure federal medical transport team from the naval base to retrieve him. However, command indicated that the chief executive officer of this hospital, along with a regional military oversight detachment, were already in the building addressing the mass casualty divert protocols." "Understood, Captain." I nodded calmly, tossing the blue towel into the biohazard bin. "The Admiral is completely stabilized. The Belmont infuser has successfully replaced his lost volume with 4 units of O-negative whole blood, and his systolic pressure is holding beautifully at 112. He isn't going to crash again." Petty Officer Jenkins, who was sitting heavily on a rolling physician's stool with his head resting in his hands, let out a long, shuddering breath of pure relief. "I thought we lost him on the roof, Commander. When that portable monitor flatlined, I swear to God my own heart stopped beating. If you hadn't been in this building, if we had been left with that panicked civilian administrator—" "You held the line, Jenkins," I said firmly, walking over and placing a reassuring hand on the tactical corpsman's broad shoulder. "You maintained proximal pressure on a severed subclavian artery while being blasted by hurricane winds and rotor wash. You kept oxygenated blood in his brain long enough for me to get the needle in. You did your duty flawlessly." Jenkins looked up, his soot-stained face breaking into a wide, exhausted smile. "Thank you, ma'am. It's an honor to serve under you again." Across the room, Leo was methodically cleaning the surgical instruments, his hands moving with a newfound sharp precision. The young resident nurse, who had spent the last 6 months constantly second-guessing himself under Dr. Pierce's toxic, metric-obsessed micromanagement, had been completely transformed. He had been baptized in the fire of real, unadulterated combat medicine, and he had risen to the occasion beautifully. Leo looked down at his own scrubs, which were stained with the Admiral's blood, and then looked up at me with wide, reverent eyes. "I've learned more about emergency medicine in the last 45 minutes than I did in 4 entire years of nursing school, Commander," Leo said, his voice filled with quiet awe. When Dr. Pierce grabbed that syringe of epinephrine and raised his hands to start chest compressions, I froze. The hospital portal algorithms always dictate epinephrine for pulseless electrical activity. I thought Pierce was right for a second. If you hadn't stopped him. "Algorithms and portal software are just maps, Leo," I explained quietly, walking over to the bedside and checking the Admiral's IV lines. "But the patient lying in the bed is the actual territory. Dr. Pierce is a man who has spent his entire career staring at the map. He looks at digital flowcharts, efficiency metrics, and liability protocols, but he has completely forgotten how to look at the territory. He didn't see a man bleeding into his pericardial sac. He just saw a red number on a screen and panicked." Before Leo could respond, a sudden, violent commotion erupted out in the main hallway. Through the thick, soundproof glass of the locked trauma bay doors, I could see a massive surge of activity. The civilian night shift nurses and junior residents were scattering like frightened birds, pressing themselves against the walls of the corridor. Marching down the center of the pristine emergency department was a tight, highly intimidating phalanx of men in dark, expensive suits and crisp military uniforms. At the center of the formation was Arthur Sterling, the chief executive officer of Mercy Crest Medical Center. Sterling was a notoriously ruthless corporate administrator, a man who valued the hospital's elite reputation and profit margins above absolutely everything else. He was impeccably dressed in a tailored charcoal suit and a long cashmere overcoat, his silver hair perfectly styled despite the early morning hour, his sharp eyes blazing with corporate fury. Walking shoulder to shoulder with the CEO was Rear Admiral Thomas Vance of the United States Navy, clad in immaculate dress blues, his chest covered in rows of colorful deployment ribbons and commendation medals. Flanking them both were 4 heavily armed military police officers wearing white belts, white lanyards, and carrying federal sidearms. Standing right outside our locked glass doors, pacing like a caged rabid animal, was Dr. Preston Pierce. The moment Pierce saw the CEO and the naval authorities approaching, he threw himself forward, waving his arms frantically, completely oblivious to the pathetic, blood-stained state of his ruined designer clothes. "Mr. Sterling! Thank God you are here! Thank God!" Pierce shrieked, his muffled voice barely penetrating the thick glass of the trauma bay doors. He pointed a trembling, accusatory finger directly at me. "You must call the local police immediately. We are experiencing a hostile, illegal takeover of the emergency department. That woman, Nurse Stone, she physically assaulted me and hijacked my trauma bay." Arthur Sterling stopped in his tracks, his cold, calculating eyes sweeping over Pierce's blood-soaked lab coat. Then looking through the glass at the 4 battle-hardened Navy SEALs standing guard around the surgical bed. "Dr. Pierce," Sterling said, his voice a low, dangerous rumble that radiated absolute corporate menace. "The Pentagon contacted my private residence 30 minutes ago to inform me that a 4-star admiral was bleeding to death on my helipad, and that my chief medical officer was actively refusing to provide emergency medical intake. Why are you standing in the hallway covered in blood, while an unregistered floor nurse is operating inside my primary surgical suite?" "Because she is a violent, insubordinate lunatic," Pierce screamed, his face turning a toxic shade of purple as he lied through his teeth, desperate to save his shattered career. "I was in the middle of executing standard, board-approved advanced cardiac life support protocols. The patient was in cardiac arrest, but Nurse Stone assaulted me. She twisted my arm, threw me to the floor, and ordered these armed military thugs to lock me out of my own department." Rear Admiral Vance stepped forward, his eyes narrowing as he looked through the glass at Captain Archer. "She is performing illegal, unverified, and highly dangerous procedures." Pierce continued to rant, spit flying from his lips as he doubled down on his desperate fiction. "She shoved a massive spinal needle directly into the patient's heart without a single radiological scan. It is blatant criminal malpractice. I demand she be placed in handcuffs and arrested immediately. I demand her nursing license be permanently revoked." Inside the room, Captain Archer looked at me, a cold, predatory smile touching the corner of his mouth. "Shall we let them in, Commander?" "Open the doors, Captain," I said calmly, standing at the head of the bed with my hands resting behind my back, in a perfect military parade rest. Archer swiped his access card. The magnetic locks disengaged with a heavy clack, and the thick glass sliding doors parted seamlessly. Dr. Pierce instantly lunged into the room, emboldened by the presence of his CEO. "Arrest her! Security, get in here and restrain her right now!" "Silence!" Rear Admiral Vance barked, his voice carrying the thunderous, crushing weight of absolute military authority. The sheer volume and power of his command made Dr. Pierce snap his mouth shut instantly, his knees visibly trembling. Admiral Vance and Arthur Sterling walked slowly into the trauma bay, the armed military police fanning out behind them to secure the doorway. Vance walked directly past Pierce without even acknowledging his existence, his eyes locked entirely on the surgical bed. Vance looked at the complex, flawlessly tied silk sutures repairing the subclavian artery. He looked at the plastic decompression catheter anchored perfectly in the second intercostal space. He looked at the massive syringe filled with 50 milliliters of dark blood resting on the surgical tray. Finally, he looked up at the high-definition wall monitors, observing the strong, perfectly stable sinus rhythm and the robust blood pressure readings. Admiral Vance turned to me. The stern, intimidating lines of his weathered face softened into an expression of profound, overwhelming military respect. "Commander Maya Stone," Admiral Vance said softly, coming to a crisp, rigid attention and offering a slow, deeply respectful salute. "The Pentagon was informed that we had lost him on the roof. They said the civilian doctors had completely panicked, but when Captain Archer relayed that the Valkyrie of the 5th Fleet was on the deck, we knew he was coming home alive. I returned the salute smoothly. Just doing my job, Admiral." Arthur Sterling, the CEO, looked completely bewildered, He looked at my cheap, dark navy scrubs, then looked at the 2-star naval admiral saluting me. "Admiral Vance?" "I don't understand," Sterling said, his brow furrowing in deep confusion. "Who exactly is this woman?" "Human Resources has her listed as a junior, Tier 2 floor nurse who works the night shift. Why are you calling her commander?" Before Vance could speak, Dr. Pierce pushed his way forward, unable to control his toxic, bubbling ego. "It doesn't matter what she used to be," Pierce shrieked, pointing wildly at the surgical tray. "She is currently an unemployed civilian. I suspended her an hour ago for failing to meet our digital discharge metrics. She assaulted me and performed a blind subxiphoid pericardiocentesis without my authorization. She endangered this hospital's liability standing." I didn't raise my voice. I didn't step forward. I simply turned my head and looked directly into Arthur Sterling's eyes. "Mr. Sterling," I said, my voice cold, clinical, and completely devoid of emotion. "When this patient arrived, he was suffering from a massive tension pneumothorax and a severed subclavian artery. Dr. Pierce refused to initiate emergency treatment because the patient did not have a synchronized digital profile in your software portal. When the patient's blood pressure dropped, Dr. Pierce attempted to use a stethoscope backward. When that failed, he attempted to administer 50 milligrams of a paralytic agent, which would have induced immediate, irreversible cardiac arrest." Sterling's eyes widened in horror. He turned slowly to look at Pierce. "That is a lie," Pierce stammered, sweat pouring down his pale face. "The patient went into pulseless electrical activity. I was preparing to administer intravenous epinephrine and begin chest compressions. It is the exact protocol dictated by the hospital's software algorithm. And that algorithm would have killed him instantly," I cut in, my voice striking like a physical blow. I stepped forward, closing the distance between myself and the disgraced doctor, forcing him to back away. "He was not in cardiac arrest, Pierce," I explained, tearing his medical competence apart piece by piece in front of his boss. "He was suffering from a traumatic cardiac tamponade caused by microscopic shrapnel. His pericardial sac was filling with blood, crushing his heart from the outside. If you had pushed epinephrine, you would have forced a constricted heart to accelerate against an immovable wall of blood. If you had performed chest compressions, you would have physically ruptured his myocardium and blown his heart to pieces on this table. You nearly murdered a national hero because you are completely incapable of diagnosing a patient without a computer screen holding your hand." The trauma bay fell into a dead, suffocating silence. Arthur Sterling stared at Dr. Pierce. The CEO was a ruthless corporate shark, but he was also a highly intelligent man. He looked at the flawless surgical work on the bed. He looked at the hardened Navy SEALs nodding in agreement with my assessment. And he looked at Dr. Pierce, who was trembling, sweating, and completely unable to formulate a coherent medical defense. Sterling realized instantly that his chief medical officer had not only almost killed a 4-star admiral, but had almost brought the full, catastrophic wrath of the United States federal government down upon Mercy Crest Medical Center. "Dr. Pierce," Sterling whispered, his voice shaking with a quiet, terrifying fury. "Is this true? Mr. Sterling, you must listen to me," Pierce begged, dropping to his knees on the slick linoleum floor, clutching at the hem of the CEO's expensive overcoat. "The software, the liability. She doesn't respect the corporate metrics. I am the surgical director. I demand my union representation." Arthur Sterling looked down at the pathetic, sobbing man at his feet with absolute, unadulterated disgust. He violently yanked his cashmere coat out of Pierce's trembling grasp, stepping back as if Pierce were a diseased rat. "You don't have a union rep, Preston, because as of this exact second, you don't have a job," Sterling said coldly, his voice echoing like a judge delivering a death sentence. Sterling turned toward the heavily armed military police standing in the doorway. "Admiral Vance," Sterling said, adjusting his suit jacket, "does the United States military have any interest in a civilian doctor who intentionally obstructs life-saving care for a federal officer during a classified operation?" Admiral Vance smiled. A cold, hard, dangerous smile. "As a matter of fact, Arthur, under the Uniform Code of Military Justice and federal counterterrorism statutes, intentionally obstructing the medical evacuation of a fleet commander is classified as treasonous sabotage." Admiral Vance raised his hand, signaling the 4 military police officers. "Take this civilian into federal custody," Vance ordered. "No local bail. No civilian lawyers. Transport him directly to the federal holding facility at the naval base." The 2 military police officers moved with terrifying, synchronized precision. They didn't shout, they didn't draw their tactical batons, and they didn't hesitate for a fraction of a second. Clad in crisp, dark federal naval uniforms with white lanyards and polished leather boots, they stepped aggressively toward Dr. Preston Pierce, their expressions as cold and unyielding as carved granite. Dr. Pierce let out a pathetic, high-pitched gasp. He scrambled backward across the slick, polished linoleum of Trauma Bay 1, his expensive custom-made shoes slipping out from under him. He crashed hard into a stainless steel rolling surgical tray, sending a massive cascade of sterile gauze packets, betadine swabs, and plastic syringes scattering wildly across the floor. "No! Stay back!" Pierce shrieked, holding his blood-stained hands up in front of his face as if he could physically ward off the United States federal government. "Mr. Sterling, you cannot allow this. I am a senior executive of this corporation. I have a binding arbitration clause in my contract. I demand to speak to the hospital's legal counsel right this second." Arthur Sterling, the chief executive officer of Mercy Crest Medical Center, didn't move a single muscle to intervene. He stood near the sliding glass doors, his hands resting calmly in the pockets of his expensive cashmere overcoat, his eyes completely devoid of any sympathy or warmth. "You don't need corporate counsel, Preston," Sterling said, his voice dropping into a chilling, absolute monotone. "You need a federal criminal defense attorney, and frankly, given the colossal magnitude of the liability you have just exposed this hospital to, I sincerely hope you can't afford a good one." "This is a massive misunderstanding," Pierce cried out, tears of sheer panic welling up in his wide, bloodshot eyes. He looked desperately at Rear Admiral Vance, then pointed a trembling finger toward me. "She is the one who broke protocol. She is the one who operated outside her scope of practice. I was simply trying to maintain our digital safety metrics. I was trying to save his life according to the software." Captain Thomas Archer let out a dark, bitter laugh that echoed harshly over the rhythmic beeping of Admiral Ross's heart monitor. "You want to talk about the truth, civilian?" Archer growled, stepping forward and reaching into the heavy tactical pouch strapped to his chest rig. "Let's talk about the truth." Archer pulled out a ruggedized, military-grade digital tablet. He tapped the reinforced glass screen twice, bringing up a highly encrypted tactical software interface, and turned toward the CEO. "Mr. Sterling, my special warfare flight medics are equipped with high-definition tactical helmet cameras that automatically activate the second the Seahawk's landing gear touches down," Archer explained, his voice ringing with absolute lethal authority. "The audio and video feeds are instantly transmitted to a secure Department of Defense server. Would you like to see exactly how your chief medical officer attempted to save a 4-star admiral?" Pierce's face, already pale from panic, drained of every last microscopic drop of color. He looked like a man who had just been shoved out of an airplane without a parachute. "No, you can't record on hospital property without written consent," Pierce stammered weakly, his voice barely a whisper against the hum of the ventilator. "HIPAA regulations. Privacy laws. You are violating corporate compliance. Federal maritime emergency." Archer snapped back, completely ignoring Pierce's pathetic whimpering. Archer swiped his gloved finger across the tablet screen and mirrored the tactical video feed directly to the massive, high-definition surgical monitor mounted on the wall above the bed, right next to Admiral Ross's stabilizing vital signs. The screen flickered, instantly displaying a crystal-clear first-person view from Petty Officer Jenkins's helmet camera. The audio kicked in, filling the quiet trauma bay with the deafening roar of the hurricane winds and the idling helicopter turbines. On the massive screen, everyone in the room watched as the tactical gurney was hauled out of the Seahawk. They saw the horrifying volume of dark arterial blood pooling on the wet concrete pad. And then, they saw Dr. Preston Pierce. On the high-definition recording, Pierce wasn't acting like a confident medical director. He was cowering near the rooftop access doors, holding his digital tablet like a shield to protect his hair from the rain, refusing to step near the bleeding patient. "I cannot accept a critical military trauma of this magnitude without administrative intake forms." Pierce's hysterical, high-pitched voice blasted through the trauma bay's internal speakers. Where are the field medical records? Where is the military transfer protocol? We don't have an open operating room assigned in the digital portal system. Sterling watched the screen, his jaw tightening so hard the muscles in his cheeks twitched visibly. The video continued. It showed Jenkins screaming that the Admiral was bleeding to death. It showed Pierce fumbling with his stethoscope, wrapping the rubber tubing backward around his own arm in sheer, unadulterated panic. And finally, it showed the most damning, catastrophic moment of all. "He needs immediate chemical suppression!" Pierce shrieked on the recording, waving a syringe wildly in the air, while the portable monitor flatlined in the background. "Get me a syringe of midazolam and a paralytic agent from the emergency flight kit. We need to paralyze his diaphragm and force a mechanical airway." Then, the video showed my voice cutting through the storm. It showed me stepping out of the shadows, calm, cold, and composed, ordering Pierce to drop the syringe before he murdered the patient. Captain Archer tapped the tablet, pausing the video exactly on the frame of Pierce's terrified, incompetent face. "Turn it off," Sterling whispered, his voice trembling with a quiet, volcanic rage. Archer locked the tablet and the screen went black. The silence in Trauma Bay 1 was absolute, deafening, and suffocating. The two junior surgical residents standing near the counter looked at Pierce with expressions of pure, unmasked disgust. Leo stood tall, his arms crossed over his chest, his eyes burning with righteous vindication. Arthur Sterling turned slowly to face the disgraced doctor kneeling on the floor. "Preston," Sterling said, every single syllable dripping with concentrated corporate venom. "You abandoned a dying man on a freezing roof because you were too cowardly to operate without a computer screen holding your hand. You prioritized our quarterly portal metrics over human survival. And when you panicked, you nearly administered a lethal dose of paralytics to the commander of the United States Fleet Forces." "Mr. Sterling, please," Pierce whimpered, tears streaming down his face as he crawled forward on his knees. "I was confused. The storm. The noise. I have dedicated my entire life to this hospital. You know my record. You are fired," Sterling stated coldly, stepping back to avoid Pierce's reaching hands. "Effective immediately. Your medical executive privileges are permanently revoked. Your office will be boxed up by security. Your shares in this corporate network are frozen pending a massive internal liability investigation. And I will personally ensure that your name is scrubbed from every plaque, directory, and document in this institution before the sun rises." Pierce let out a pathetic, broken sob, collapsing onto the linoleum floor in a heap of ruined fabric and total, absolute humiliation. The man who had terrorized floor nurses, bullied residents, and worshipped administrative spreadsheets had been utterly destroyed by his own incompetence. Rear Admiral Vance gave a sharp, subtle nod to the military police. "Dr. Preston Pierce," one of the MP officers announced in a booming, authoritative voice, stepping forward and grabbing Pierce roughly by his right arm. "You are being taken into federal custody under Title 18 of the United States Code for obstructing emergency medical care during a national security event, criminal negligence, and making false official statements to military authorities." And the second MP officer grabbed Pierce's left arm, hauling the sobbing, hysterical former doctor up from the floor with effortless mechanical force. Click-clack. The heavy, cold steel handcuffs locked tightly around Pierce's wrists with a sharp metallic snap that echoed loudly through the quiet trauma bay. "No, you can't do this! I am a board-certified surgeon!" Pierce shrieked, thrashing wildly as the two massive military police officers dragged him toward the sliding glass doors. "I am the chief medical officer. Mr. Sterling, help me. This is an outrage. Nurse Stone, tell them. Tell them it was a misunderstanding." I didn't blink. I didn't say a single word. I just stood at the head of Admiral Ross's bed in my dark navy scrubs, my hands resting calmly behind my back, watching with cold, clinical detachment as the tyrant was dragged out of the room. Pierce's pathetic screams echoed down the main corridor of the emergency department, fading away into the distance as he was paraded in handcuffs past the dozens of civilian nurses, technicians, and doctors he had bullied for 14 months. The reign of corporate terror at Mercy Crest Medical Center was officially over. Once the heavy glass doors slid shut, sealing the trauma bay back into a quiet, sterile sanctuary, Rear Admiral Vance let out a long, heavy sigh. He walked slowly over to the bedside, looking down at the steady, rhythmic rise and fall of Admiral Ross's chest. "The surgical intervention you performed today was nothing short of a miracle, Commander Stone," Vance said softly, turning his weathered face toward me. "The Pentagon has reviewed your service record. 14 years of flawless combat medical operations, 2 Purple Hearts, the Distinguished Service Cross. You commanded forward surgical teams in the most dangerous corners of the globe. Why did you walk away from the Navy? Why hide in a civilian hospital on the graveyard shift?" I looked down at the floor, thinking about the dusty tents in Kandahar, the blood, the artillery fire, and the sheer crushing exhaustion that had finally broken my spirit. "I was tired, Admiral," I answered honestly, my voice quiet but firm. "I spent over a decade pulling shattered young men and women out of the dark. I watched too many good people die on my operating tables because we simply didn't have the resources to save them. When my last deployment ended, I wanted peace. I wanted fluorescent lights, sterile supply rooms, and a job where emergencies arrived one at a time. I took off my rank because I didn't want the burden of command anymore. I just wanted to be a floor nurse. You can take off the uniform, Maya," Captain Archer said gently from the other side of the room. "But you can never take off the combat surgeon inside you. When the storm hits, you run toward the blood. It's woven into your DNA." Arthur Sterling cleared his throat nervously. The ruthless corporate CEO looked completely out of his element, standing between 2 highly decorated naval officers and a legendary combat surgeon. "Nurse Stone, or rather, Commander Stone," Sterling began, his voice surprisingly humble and deferential. "Mercy Crest Medical Center owes you an unpayable debt. You saved this hospital from an absolute catastrophic federal disaster today. I want to formally apologize for the suspension order Dr. Pierce issued against you. It is entirely voided. But more importantly, we are now facing a massive leadership vacuum." Sterling took a deep breath, looking around the highly advanced trauma bay, then back at me. "The board of directors will be terminating Dr. Pierce's entire executive team by noon," Sterling continued. "This hospital needs a leader who understands real medicine. A leader who commands respect, not through digital metrics and software portals, but through clinical excellence and raw courage. I want you to take over this emergency department. I want you to be the new chief of trauma services." The entire room went completely silent. Leo's jaw dropped, his eyes darting toward me with wild, overwhelming hope. Petty Officer Jenkins grinned broadly, crossing his massive arms over his chest. Rear Admiral Vance stepped forward, pulling a crisp, white, sealed federal envelope from the inside pocket of his dress uniform. "The Department of Defense fully supports Mr. Sterling's proposal," Vance announced formally, handing the heavy envelope across the surgical bed to me. "In fact, we are mandating it. By executive order of the Secretary of the Navy, Mercy Crest Medical Center's Trauma Division is hereby being placed under a permanent joint federal military oversight charter. We are restructuring this facility into the Eastern Regional Combat and Civilian Trauma Center." Vance looked me directly in the eyes, his expression filled with absolute, unwavering trust. "We need a commander to run this joint facility, Maya," Admiral Vance said softly. "The military will provide the funding, the tactical transport helicopters, and the elite corpsmen. Mr. Sterling will provide the civilian infrastructure. But you will provide the leadership. The deck is yours, Commander, if you are finally ready to stop hiding in the shadows." I looked down at the sealed federal envelope in my hands. The heavy gold crest of the United States Navy gleamed under the bright fluorescent lights. I looked at Leo, who was practically vibrating with excitement. I looked at the steady, beautiful green line of Admiral Ross's heartbeat on the monitor, knowing I had just given that man his life back. For 14 months, I had tried to bury the warrior inside me under cheap Navy scrubs and quiet compliance. I had tried to run away from the heavy, crushing responsibility of command, pretending I could find peace by submitting to arrogant bureaucrats and digital spreadsheets. But as I felt the solid weight of the federal orders in my hand, I finally accepted the absolute truth. I wasn't a quiet floor nurse. I was a combat surgeon. And my place was at the absolute front line of the storm, leading my team into the dark to pull people back into the light. 3 weeks after the federal oversight order permanently restructured Mercy Crest Medical Center into the Joint Regional Combat and Civilian Trauma Center, The morning sun broke over the city skyline, casting bright golden light across the newly renovated glass entrance and the pristine brick facade. The dark, chaotic memories of that stormy morning had settled deep into the foundation of a completely rebuilt institution. Outside the main entrance, heavy industrial construction crews were putting the finishing touches on the massive, dual-redundant generator grid, ensuring that this facility would never experience a power failure under any circumstances again. Every underground cable had been reinforced, and every backup system rigorously tested. Inside the main floor, the changes were even more striking. The cold, sterile corporate atmosphere that Dr. Preston Pierce had enforced for months had been entirely replaced by sharp, military-grade efficiency, combined with deep, compassionate patient care. The waiting room was quiet and orderly, free of frantic families waiting hours for basic updates, while the corridors hummed with purposeful energy and disciplined calm. I walked down the wide, brightly lit main corridor of the ER wing, wearing my crisp, dark navy scrubs with my official Chief Executive of Trauma badge pinned proudly to my chest. My boots made a steady, rhythmic sound against the polished linoleum floor, a stark contrast to the quiet, hesitant footsteps I used to take when I tried to hide in the background behind a junior nurse's badge. Beside me walked Leo, looking confident, upright, and wearing his new assistant chief nurse badge with quiet, deserved pride. He was holding a digital tablet, reviewing the morning shift assignments with practiced ease and calm authority, occasionally stopping to verify supply counts with passing residents and medical interns who respected his leadership. "All trauma bays are fully prepped, sterilized, and stocked, Commander Stone," Leo reported smoothly, his voice grounded, mature, and professional. "To ensure complete readiness, 4 military medical specialists are assigned to Bay 1 and Bay 2 for the morning shift. The new blackout simulation protocols were successfully executed by the resident team at 0600 hours with a 100% compliance rate." "Excellent work, Leo," I said, a faint smile touching my lips. "How is the nursing staff handling the new triage structure compared to the old portal system?" "They love it," Leo grinned, looking back over his shoulder at the bustling station. "No one is rushing patient discharges to meet artificial portal timers anymore. The focus is entirely on clinical safety, accurate diagnostics, and patient outcomes. It actually feels like a true emergency department now, where human lives matter more than administrative spreadsheets." "Keep reinforcing that standard," I instructed, checking my clipboard. "Clinical competence always comes first. Metrics are secondary." "Always, Commander," Leo nodded firmly. We stopped outside Trauma Bay 1. The heavy glass doors parted smoothly as Captain Thomas Archer and 3 members of his Naval Special Warfare Unit walked down the corridor. Archer was wearing his crisp dress uniform, standing tall, his posture straight, military, and unyielding. He stopped right in front of me, offering a firm, respectful handshake that carried the solid weight of mutual respect forged under fire. "Commander Stone," Captain Archer said, his voice filled with deep appreciation. "Admiral Edward Ross has made a full recovery following his vascular reconstruction surgery, and he asked me to personally deliver this to you before our detachment rotates back to active fleet operations." Archer reached into his jacket pocket and pulled out a small, heavy velvet box, handing it across to me with both hands. I opened the box. Inside rested a polished silver challenge coin, bearing the emblem of the United States Fleet Forces Command and the crossed medical insignia of the Navy Medical Corps. That coin means that whenever you or your trauma department need anything from our fleet, specialized equipment, tactical medical transport, or direct operational backing, you call us directly, Archer said quietly, his dark eyes unwavering. "You saved the Admiral's life that morning, Commander. You always were, and always will be, our anchor." "Thank you, Captain," I said, closing the box and holding it tightly in my hand. "It was an honor to stand beside you." Archer and his men gave me a sharp, crisp military salute, which I returned with absolute pride, before walking down the corridor toward the exit where their transport vehicle waited in the bright morning sun. I watched them leave, feeling a deep, abiding sense of peace settle over my chest. The ghosts of my past deployments no longer felt like a dark secret I had to bury beneath scrubs and silence. They were part of the resilience that allowed me to stand tall today. I walked back down to the central nursing station. The morning light poured through the large glass windows, illuminating the corridor where civilian nurses and military medics worked side by side, checking equipment, discussing patient care plans, and preparing for the day ahead with smooth, synchronized teamwork. Rear Admiral Vance walked out of the command office, holding a clipboard with the updated tactical transport schedules. He gave me a warm, approving nod as he approached. "Everything looks tight and ready for action, Commander Stone," Vance said, pausing by the desk. "That's how we keep it, Admiral," I replied calmly. "Zero margin for error across any sector. By the way," Vance added with a faint smirk, "the Department of Justice just forwarded the final docket regarding Preston Pierce's upcoming federal trial. His bail was officially denied again this morning by the federal judge. He's facing up to 20 years in federal prison for medical record fraud, obstruction of emergency care during a national security event, and making false official statements to federal agents. A man who spent his entire career hiding behind titles and portal metrics finally found out where vanity gets you when lives are on the line," I said softly, looking toward the exit doors where Pierce used to strut. "Indeed," Vance nodded. "And the hospital board has elected Arthur Sterling to permanently retain his position as CEO under the new Joint Oversight Charter, provided he keeps administrative interference strictly out of your trauma bays." "He knows better than to try," I noted with a confident smirk. I spent the next 2 hours conducting joint civilian-military rounds with the resident physicians, reviewing advanced diagnostic protocols, and ensuring every single nursing station was fully optimized for rapid emergency response. The atmosphere was completely transformed. No one whispered in fear or rushed through critical evaluations to beat an arbitrary clock. Every physician and nurse understood that saving lives required absolute dedication and unhurried focus. We held detailed briefings on advanced hemorrhage control and coordinated airway management, establishing a culture where every voice mattered regardless of rank or background. As I reviewed patient charts at the central desk, I remembered the dusty combat tents in foreign fields, where every second counted and every decision was a matter of life and death. For a long time, I thought I had left that person behind. But that stormy morning proved that the instincts forged in combat never truly fade. They simply wait for the moment when they are needed most, reminding us why we chose this sacred calling in the first place, and strengthening our resolve to protect every single soul that crosses our threshold without hesitation, doubt, or administrative compromise. Leo stepped up to my side, holding a fresh cup of black coffee and smiling warmly. "You know, Commander, looking at how far this department has come in 3 weeks makes every sleepless night worthwhile. We finally have an emergency room that honors healing over corporate profits, and the entire staff is proud to stand behind your leadership through every challenge ahead." "Nurses and corpsmen built this together, Leo," I replied, taking the cup and feeling the warmth against my fingers. "And we built it on a foundation of absolute truth and clinical excellence that no bureaucrat will ever tear down again. Resting in a place of permanent honor on the shelf right behind the central station, illuminated by a clean glass display case, was my old military field medical pack. The faded canvas, the hand-stitched repairs, and the faint dark stains from combat zones were no longer hidden away or threatened with a trash bin. They were a testament to courage, resilience, and the unyielding refusal to let people die in the dark. Suddenly, the red emergency radio on the central station desk buzzed to life, its sharp tone cutting clean through the steady hum of the room. "Bizazazazata! Joint trauma, this is Paramedic Unit 4. We have a multi-vehicle collision on the interstate incoming. 2 critical red code traumas with severe crush injuries and internal hemorrhaging. ETA, 4 minutes. Leo looked at me instantly, his face composed, sharp, and completely ready for the incoming shock. "Bay 1 and Bay 2 prepped," Leo called out loudly, his voice echoing authoritatively across the entire ER station. "Team Alpha, fall in. Prepare rapid infusers, whole blood units, and field surgical trays." The staff moved with fluid, practice precision. There was no panic, no screaming, and no arrogance. Just a dedicated team moving as one to save human lives. I unhitched my stethoscope from my belt, looped it around my neck, and stepped up to the central line in Trauma Bay 1. I looked down at the silver challenge coin in my pocket, then at the bright lights overhead. For 14 months, I had hidden in the quiet shadows, trying to run away from who I was and what I had survived. But as the double red doors of the ambulance bay burst open, and the transport gurneys rolled in, I knew I was finally where I belonged. I was no longer the quiet floor nurse they suspended. I was Commander Maya Stone. And as long as I was standing in this bay, breathing and leading my team, absolutely nobody was ever going to die in the dark again.